We have a pandemic for those who haven't gotten a vaccination. It's that basic, that simple. 10,000 people have recently died. 9,950 of them or thereabouts are people who hadn't been vaccinated. This is a simple, basic proposition. If you're vaccinated, you're not going to be hospitalized, you're not going to be in an ICU unit, and you're not going to die.
New at midday, at least 2 people in Clark County have died after being fully vaccinated against COVID. The Southern Nevada Health District adds 23 people have been hospitalized. Now, the county calls these cases breakthrough cases, which refers to people who are fully vaccinated but still get the virus. As of last week, it's identified 141 breakthrough cases. The health department says it expects to see more cases like these. And you can read the health department's full report on our website. Just head over to ktnv.com.
So it's gigantically important that we all act like Americans or care about our fellow Americans. There's legitimate questions people can ask that they worry about getting vaccinated, but the questions should be asked, answered, and people should get vaccinated. But this is not a pandemic. We've made sure that since I got in office, we've inoculated over 160 million people. It's a little bit like when I got elected. This pandemic was out of control. We've lost more people in the United States, over 630-some thousand people, than in every major war we've ever fought in the United States of America. And that's come to a screeching halt for those who've been vaccinated. It really has, not a joke. This is overwhelming evidence to sustain that. And so what I say to people who are worried about a new pandemic is get vaccinated. If you're vaccinated, even if you do catch the virus, quote unquote, like people talk about it in normal terms, you're an and not many people do. If you do, you're not likely to get sick. You're probably going to be symptomless. You're not going to be in a position where your life is in danger. Yeah. So it's really kind of basic. The CDC is going to say that what we should do is everyone under the age of 12 should probably be wearing a mask in school. That's probably what's going to happen. Secondly, those over the age of 12 who are able to get vaccinated, if you're vaccinated, you shouldn't wear a mask. If you aren't vaccinated, you should be wearing a mask. So it's going to get a little bit tight in terms of, well, are mom or dad being honest that, Johnny did or did not get vaccinated? That's going to raise questions. But I think what's going to happen is you're going to see this work out in ways that people are going to know in the community. Everybody knows in the community whether or not Johnny really did get the vaccination when he's 15 or 17 years old.
And obligates covered entities and their business associates to comply with protecting their information. As a general rule, patients must authorize any disclosure of their PHI. This includes all individually identifiable health information.
But again, one last thing. We don't talk enough to you about this, I don't think. One last thing that's really important is we're not in a position where we think that any virus, including the Delta virus, which is much more transmissible and more deadly in terms of unvaccinated people, the various shots that people are getting now cover that. You're okay. You're not going to get COVID if you have these vaccinations.
Yeah. You're not going to get COVID if you have these vaccinations. Yeah.
I want to stay on this subject. I want to get to Dr. Nicole Baldwin. She's a pediatrician and a Republican. Dr. Baldwin, go ahead.
Doc, how are you?
Hi. Thank you for taking my question, Mr. President. I am a pediatrician who utilizes social media to educate about health, and I'm very concerned about the rise in misinformation from the anti-vaccine community that is eroding trust in life-saving vaccines. Spread of this misinformation and declining vaccination rates could leave Americans vulnerable to vaccine-preventable diseases in the future. So what I want to know is, what is the White House doing to combat medical misinformation and to restore America's faith in science?
What we're doing is, number one, restore America's faith in science, is listen to the scientists. Number two, you may have heard, I never get myself in trouble, as you know, politically, but you may have heard that I was critical of some of the things that are on Facebook. And I was attacking Facebook. I wasn't attacking Facebook. There was a report out saying that for that something like 45% of the overwhelming disinformation on Facebook comes from 12 individuals. I said they're killing people. Those 12 individuals, that misinformation is going to kill people. Not a joke.
Facebook is not confirming or denying working with the White House. It says this in a statement: we permanently ban pages, groups, and accounts that repeatedly break our rules on COVID misinfo.
If you're vaccinated, you're not going to be hospitalized, you're not going to be in an ICU unit, and you're not going to die.
New at midday, at least 2 people in Clark County have died after being fully vaccinated against COVID.
You're okay. You're not going to get COVID if you have these vaccinations.
You're not going to get COVID if you have these vaccinations. Yeah.
Kat Sadler is urging people to not let their guard down after she contracted the coronavirus while being fully vaccinated. The entertainment reporter revealed on Instagram Tuesday that she had contracted COVID-19 after caring for an unvaccinated person with the virus, whom she initially thought just had the flu. She posted a selfie of herself in bed and explained that she, quote, assumed I would be fine, adding, well, I'm not. Sadler revealed that she's dealing with intense symptoms while fighting the virus at home, sharing 2 days of a fever now, head throbbing, extreme congestion, even some weird pus coming out of my eye. She added that she has serious fatigue and no energy to even leave the bed. According to the CDC, developing COVID-19 after getting fully vaccinated is rare, but it is possible and expected, as the vaccines are not 100% effective against the virus.